Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center. We recently got a paper published in Frontiers of Neurology that I want to go over. And there's a term that I coined called cervicovagopathy. So you can get vagus nerve degeneration just from a breakdown of the neck curve from ligamentous cervical instability. So the paper is about that, and we have some patient data which I wanted to go over. And if you have cervicovagopathy or vagus nerve degeneration from a breakdown of your neck curve, would encourage you to get an evaluation here at the Hauser Neck Center in Fort Myers, Florida. But the paper is called Cervicovagopathy, Ligamentous Cervical Instability, and Dysstructure. So that's another term that I coined. Cervical dysstructure is breakdown of the neck curve. So I just want to see like this is a model of a human head, and you see inside is the cervical curve, and you could see where there's like a C here. So that's the lordotic curve. So imagine what happens as people look at cell phones and they're looking down, and now the neck curves like this. You can imagine what structures right here by this forward atlas would be injured with the forward atlas because of the breakdown of the neck curve. The main tissue that's injured is the vagus nerve. The vagus nerve innervates the lungs, the heart, the digestive tract, the spleen, which has to do with the immune system, the liver, the pancreas. So when you get vagus nerve degeneration, your stomach can be affected, your pancreas, digestion, you can get leaky gut, you can have immune deficiency problems, you can get autoimmune disease, you can get heart arrhythmia, you can get shortness of breath, you can get lung conditions. Do you realize about a third to a half of medical condition, they're idiopathic or no known etiology? Well, I think there is a known etiology for a lot of these medical conditions, and that's called cervicovagopathy. So the title of the paper is Ligamentous Cervical Instability and Dysstructure as a Potential Etiology for Vagus Nerve Dysfunction and the Cause of Human Symptoms and Diseases. It's in Frontiers of Neurology 2025. And I'd really encourage anybody who has a chronic health problem to consider reading this article. And I'm just going to go over it pretty briefly. So we found out that basically with certain symptoms, and this is 232 consecutive patients with various symptoms coming to the Hauser Neck Center here in Fort Myers, Florida. So we had 190 people with anxiety, 179 with dizziness, 205 with fatigue, 178 with lightheadedness, 174 with irritability, 149 with insomnia, neck grinding, neck pain, sleeping problems. And you see that all of them had severe vagus nerve degeneration. Almost all of them had really compressed jugular veins. They had loss of the neck curve. The atlas on average was about 40 to 42 millimeters forward. So that's about 1.5 inches forward. There was significant flexion instability, meaning that the vertebrae, when they flexed, they had anterolesiosis, or some of the vertebrae went forward. Then they had extension instability. And the most significant finding was upper cervical instability. So in other words, if you have tightness here, it's always painful here. You feel pressure up here in the upper cervical region, or you have clicking, popping, grinding of your neck. It's likely you have instability there. And the way we document that is by motion x-rays. We do digital dynamic radiography or digital motion x-ray. We have both machines here. And the treatment that we do for that is prolotherapy. And this just explains that the vagus nerve is involved in so many different functions in the body. The vagus nerve lowers the heart rate, lowers the blood pressure. I recently saw a patient, I think from New Zealand. The lady was very thin. I checked her blood pressure in the office. It was 190 over 110, and she's very thin. That's from vagus nerve degeneration, because the vagus nerve and the glossopharyngeal nerve in the neck are the blood pressure sensors. So if your blood pressure sensors are off, the blood pressure can go very high. Also, we've had people come in who exercise and everything, and they notice that their pulse rate is very high now. Like they normally have a pulse rate of 52, now the pulse rate's 75. Or if you all of a sudden have palpitations and tachycardia, that's almost assuredly that you have vagus nerve degeneration. And if that's the case and you have vagus nerve degeneration, it's likely from your neck, and you need to go to a facility that understands how neck structure affects the vagus nerve, like the Hauser Neck Center. Then all the tight junctions of the body, the lungs, the digestive tract, things don't get into the lungs or get into the human body that are bad for you because the columnar cells or mucosal cells are stuck together in the digestive tract. Well, when you get vagus nerve degeneration, you can get leaky lung. Well, what would leaky lung cause? Well, you could have asthma, right? You could have reactive airways because now certain things in the air like pollens and mold. Like I look at mold, not mold infestation in the body. I look at it as a leaky lung issue, and the person really just has to get their vagus nerves repaired, which you do that by getting rid of the compression from the forward head or the cervical dysstructure by cervical curve correction and prolotherapy. And then leaky gut, in my opinion, is more related to vagus nerve degeneration than food sensitivities and all the other stuff. It doesn't mean that we shouldn't eat healthy. Of course, eat healthy. But the patients that come to Caring Medical, normally they've had all kinds of testing by functional medicine people, and they still have the symptoms. So it probably is that more and more people, because of the massive looking down at cell phones, that the neck curve is breaking down, and that breaking down the neck curve, of course, leads to compression of the vagus nerve. The vagus nerve gets degenerated, then they get the leaky gut, then they get the hormone problems, then they get the mold problems, then they get the myriad of symptoms. So the way to reverse it is you've got to get to the initiating problem, which is the breakdown of the neck curve. So that's what I would encourage people to do, and that's why we published this paper. Then, of course, the immune system can be affected by vagus nerve degeneration. Do you or somebody you love have all these symptoms? And these symptoms are occurring at earlier and earlier ages. So in the studies that we do here at Caring Medical, we often have our cohort or the group that we studied, like this paper. Again, it's not one person, it's not two people, it's 232 people, consecutive patients that we saw. People that are aged 20 to 50, and they have no known etiology of the condition. They weren't in a trauma, they weren't in a car accident, they're just what appears to be somebody who has a mysterious illness, and they have allergies, arrhythmias, leaky lung, they have all these various symptoms. So if you have some of these symptoms, tinnitus, visual problems, you're getting blurry vision, you don't eat any food and you seem to be gaining weight for no reason, right? So is the treatment to get on some weight loss thing, or maybe you should get rid of why you have all these other things, which might be related to ligamentous cervical instability. More and more people, right, have decreased hearing, decreased vision, chronic cough, change in voice, personality changes, obsessive compulsive disorder, anxiety, depression. All these things, especially in young people, kids, teenagers, adolescents, 22-year-olds. I had a person who was age 30, recently got married. When I went like this, so in other words, I'm testing, they're 30, and in other words, I'm testing I'm just moving the arm, and it was like clunk, 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 clunk. They had cogwheel rigidity, which is a sign of Parkinson's, and the person said they're tremors, so they're only 30 and they're going like this. They said the tremor started at the age of 20. That person's going to get Parkinson's if something doesn't happen. And the cause of these conditions, and they had the conditions for 10 years. I'm just telling you, if you've just started to get these symptoms, have us be the clinic of first resort before going to 10 other places and realizing when it's all said and done, it's a breakdown of the neck curve. And if you're just one of those people that looks at your cell phone for 10 hours a day, or you work on the computer and you've had bad posture for a lot of years, I'm just telling you, this is the cause, likely the cause of all these symptoms. Right? And this just explains some of the neurology. So some of the neurology is the vagus nerve basically originates from the brainstem. The brainstem it's just above the upper cervical spinal cord. So the upper cervical spinal cord goes into the brainstem, goes into the brain. So in other words, the brainstem is like is the relay system. So a lot of the nerve impulses from the body, the neurons go into the brainstem, then there's neurons that connect to the brain. And the cranial nerves, like the vagus nerve, it originates in the brainstem. You might say, well, how does the forward atlas affect it? Well, the vagus nerve runs right in front of the vertebrae, and then it goes through a hole in the diaphragm to go into your digestive tract. But it runs right next to the anterior vertebrae. So when you have a forward head, it just presses on it, presses on the vagus nerve, presses on the vagus nerve, smashes the vagus nerve. Then the vagus nerve gets more and more degenerated. And guess what? Then it can't reduce your stress. It can't, because it lowers the heart rate, it lowers the blood pressure. So what happens is somebody feels more and more and more stressed. Then you start to get depressed, because the good hormones like serotonin, the happy hormones, they're made through vagus nerve stimulation. Then the stomach acid is made by vagus nerve stimulation. So guess what happens if you can't make stomach acid? You can't digest your food good. So then all of a sudden you're going to get all kinds of nutrient deficiencies. The treatment isn't, oh, we got to address the food. That shouldn't be the first line treatment. The first line treatment should just be, let's restore the vagus nerve to healthy function and get its size good. We measure the size. And you saw from the initial data here, the size, so instead of being over 4.2 for both of them, so each vagus nerve should be over 2.1 millimeters squared, which is the cross-sectional area. Most of them showed that it's like 1.3. So the average person that came in, they probably have 40% of their vagus neurons are no longer there. They're gone. And they're only going to get restored if you decrease the force on them. Okay, then this shows that the jugular ganglion and the nodose ganglion, that's where the DNA of the vagus is. It sits right around the atlas, which is C1. So see how the vagus nerve goes right on the anterior border of the vertebrae. And when the atlas goes forward, it smashes on the ganglion, especially the nodose ganglion. That's where the DNA, a lot of the vagus nerve is. So once you destroy the DNA of the vagus nerve, then that neuron cell dies. And then other structures that can be damaged by ligamentous cervical instability or cervical dysstructure, the glossopharyngeal nerve. That's again another blood pressure sensor. It also innervates some of the muscles for swallowing. So if you're having difficulty swallowing or you feel like food's getting caught, that could be vagus nerve degeneration. The spinal accessory nerve, that's also in a structure called the carotid sheath. That's where the jugular vein is, this nerve, that nerve, this nerve, the vagus nerve. So when you have cervical dysstructure or ligamentous cervical instability, that gets compressed. So the spinal accessory nerve innervates your trapezius and your sternocleidomastoid. So if you have shaking, you have tension in your trapezius, you have tension here, or you feel like your head is moving to the side, or you're starting to get like this, that can again be damage or irritation of the spinal accessory nerve. So I'd encourage you again to get an evaluation to see if that's occurring in you. Now this is just a pictorial of how the vertebrae change. Basically a person's looking down, they're addicted to their cell phone. They're addicted to their cell phone, they're looking down all the time. The ligaments get damaged in the neck. Then the vertebrae, with motion testing, they have anterolisthesis or spondylolisthesis. Then it can compress the autonomic nerves in the neck, including the vagus and the superior cervical sympathetic ganglion. That can get affected, which affects brain circulation. It can affect the heart. You can get tachycardia and a lot of other symptoms. And then this just shows a normal cervical lordotic spine. When you have ligamentous upper cervical instability, it smashes on the vagus and the jugular. When the jugular is compressed, when you're sleeping, the primary way in which fluid gets out of the brain is through the internal jugular veins. When the jugular vein gets compressed, the brain is swimming in basically a toxic soup. You got to restore the jugular vein flow. And in the office, we put people in different positions and we can tell them exactly the position that the jugular vein is most open. And this is vitally important as it relates to getting good sleep. So these are all the different ways that the vagus nerve can get injured. Like it can be a breakdown of the curve. You can have an excessive thoracic kyphosis. You can get a forward head posture. Even your jaw, right? You got all kinds of jaw problems. You know, people will spend $20,000, $30,000 on dental work when all they had was ligamentous TMJ instability or neck instability that could have been corrected before they have, you know, massive amounts of dental work. And then elongated styloids. So we document that by upright cone beam. So occasionally people have to get their elongated styloids removed. Again, when the atlas shifts forward, you can not only degenerate the vagus, but you can block it, meaning that the nerve impulses are getting blocked. So we get a lot of storms here in Southwest Florida. The lights flicker during a storm. So imagine that's happening to your vagus, like intermittently the impulses are getting blocked. So that could be why one day you wake up and your stomach is so bloated and you feel terrible, and another day you don't feel that bad because there's an intermittent conduction block of the electricity of the vagus. And that's where people can sometimes get an upper cervical adjustment by an orthospinalogy doctor or a NUCA doctor that adjusts the atlas, and they feel tremendously better, but then the next day they feel terrible again. That's another sign that you probably need some prolotherapy in the upper cervical region. This is what the vaguses look like. That's the normal vagus nerve, normal size, and that's what a degenerated one looks like. And you could see that, see how here the carotid arteries open, the jugular veins open. Here in this particular patient, the jugular vein is compressed compared to there, but the carotid arteries open. We don't see a lot of carotid arteries being compressed with these conditions because the carotid artery has a muscular wall. So it's much more resistant to compression. The jugular vein doesn't have a muscular wall, so it's easily compressed. And then you can basically have a person and you can put them in different positions to see if the vagus nerve or the jugular vein is under tension. In certain positions it's really open, and in other positions it's not as open as much. And then I won't go through this in great detail, but it basically shows that when you have vagus nerve problems, your heart rate variability goes down. And now with the Oura Ring, the Apple Watch and different things, you can measure your heart rate variability. So I'd really recommend to everybody, if you want to know like how your vagus nerve is functioning, consider getting a heart rate variability monitoring device. And if you're feeling terrible, you got a whole bunch of symptoms and your heart rate variability is low, then it's a good idea to get checked out for all these things. And this just kind of shows that the potential symptoms from ligamentous cervical instability and the pathology it causes, including vagus nerve degeneration and dysstructure. So person has a forward head. They get ligamentous upper cervical instability. The vagus nerve and the brainstem get injured or stretched, and they get vagus nerve conduction blocks, and then of course the internal organs aren't doing well. So if you have an internal organ problem that nobody can seem to figure out why it's not doing well, then it's probably the electricity to it is being affected. And this just shows all the different ways that breakdown of the neck curve or ligamentous upper cervical instability causes all kinds of problems, including swallowing problems, spastic torticollis, increased brain pressure, cognitive decline. You have a older parent that's having cognitive decline, it's probably their jugular veins are blocked. They should get an evaluation for jugular vein compression, and if they have it, then figure out how to open it up. And what we'll do is try to figure out exactly why the jugular veins are getting blocked, what position they need to sleep in, what exercises they need to do, and if they need prolotherapy or they need a styloid removed, we'll let them know. And then this is normally what we find is that people have cervical instability and a breakdown of the neck curve, and that's why they need a looking up lifestyle, and often they need some prolotherapy just to stabilize the area. And then the cone beam CT scanner that we use to see the 3D anatomy, and then we'll do various testing with different motions, and then we'll do measurements such as the depth of the cervical curve, how forward is the head, whether or not they have upper cervical instability, extension instability, and flexion instability. Here you can see the person had a severe upper cervical instability of 7.1 millimeters on one side, and then multi-level flexion instability. So they're going to need a lot of prolotherapy. And then this was just a case study that we put in the paper, and it just showed that, you know, how with treatment, the upper cervical instability during treatment went from this to this. I tried to put in just a case of an average case, and the person almost all of their symptoms reduced. Some of them were completely resolved and some of them were partially resolved. So I would encourage you to read the paper, and if any of this applies to you, hope to see you at the Hauser Neck Center here in Fort Myers, Florida.